This presentation contains breakthrough tips for immediately increasing your dental practice revenue, boosting client retention and loyalty, and identifying breakdowns in practice management that result in loads of lost revenue, all while providing a higher level of client care. If you follow our evidence-based programs that have revolutionized the way practices approach revenue growth, you can expect to see immediate positive change in productivity, staff engagement and morale, and communication that will keep your appointment scheduler booked for months in advance. You can also expect an unprecedented surge in hygiene revenue and client referrals. What won't you miss? The less than optimal treatment plans, staff and client miscommunication, and stress that wreak havoc on so many practices. Learn why the hygiene department is the epicenter of practice revenue, and why the top 25% of practices generating 50% more revenue than the average practice are generating 67% more revenue through their hygiene department. You'll also learn how your current hygiene protocols are keeping clients on a 3-month treatment merry-go-round, with no change to their oral health and in fact getting worse, all the while missing key opportunities to optimize care and revenue. But before we go any further, let us assure you that our programs have nothing to do with gimmicks or quick-fix schemes. Instead, we focus on the evidence-based literature, taking you back to the basics of what you already know and optimizing it, elevating the standards of care in your unique practice. It's the same technique that has helped our clients double their revenue in less than 18 months and double their new patient referrals in the same time. So how do we do it? Meet Alan. He's a dental hygienist at one of Canada's largest dental practices. When Alan started working at his current job, there were 70 staff members, including 7 hygienists, 5 dentists, and 3 specialists. And like many practices, their protocols regarding client care were all over the map. For starters, client notes were vague and incomplete, and rarely provided enough information to help Alan understand the client's conditions and what had occurred during previous appointments. Reviewing a client file was like looking at 5 pieces of a 1,000-piece puzzle. This miscommunication meant that Alan relied a lot on guesswork when it came to carrying out a long-term treatment plan. And it's no surprise that frustration levels grew, as the ball was frequently dropped between clinicians and departments because there were no set systems, no common language, keeping everyone on the same page. So things got worse. When it came to the actual dental assessments, the hygiene team had no set protocols identifying which assessments were required or how often, making it virtually impossible to provide clients with consistent, complete, and appropriate assessments and treatment plans. Periodontal disease flourished, client frustration skyrocketed, and Alan's confidence plummeted. He and others lacked the courage to ask their clients to return, even one more time, to finish their cleaning. Because Alan and his team were not completing the required assessments, there was no accurate diagnosis, no logical treatment plan, ineffective implementation, and pointless evaluations. How quickly they had forgotten their core structure for treatment as a hygienist. ADPI. Alan would soon discover that the secret to practice success would lie in relearning the fundamentals of the profession. With the coaching and education of GEM Dental Revenue Experts Inc. and their team, he relearned the periodontal case types, brushed up on the science and theory of dental hygiene, and began implementing the standards of care in non-surgical periodontal therapy. In no time, he and his fellow team members began to make accurate, evidence-based diagnoses, confident and effective treatment plans, productive evaluation appointments, and informed referrals. For the first time, Alan's entire team began following the same protocols. They were all speaking the same language to each other and their clients, and client compliance went through the roof. The clients became raving fans, telling all their friends and family. But there was more to do. The entire front-end staff and insurance department would have to be calibrated to the hygiene staff. Why the hygiene staff? Because studies show that 80% of clients trust their dental hygienist and their hygienist's recommendations. They are the trusted front line of care and communication. And in Alan's practice, the hygienists had quickly become dental superstars, boosting revenue and providing the highest quality of care. Once the front office staff was briefed on the new hygiene protocols and procedures, the entire practice ran like a well-oiled machine. Confidence among team members began to soar as they were able to sell treatment greater than $1,000 to clients even with no insurance. Revenue growth exploded, but ultimately the clients benefited the most because the results were undeniably amazing. Once Alan discovered the impact he had on his clients' oral health and practice success through non-surgical periodontal therapy, he felt empowered, and that feeling was reflected in their growing bottom line. Since implementing GEM Dental Revenue Experts, Inc.'s revolutionary approach, pioneered by CEO Gabrielle Nature, Alan's practice has hired 11 more hygienists, 5 more dentists, 3 more specialists, and 16 additional support staff, for a total of 110 staff members to keep up with demand. GEM Dental Revenue Experts, Inc. programs give businesses large and small a step-by-step plan for optimizing revenue, and it works. To learn more about our groundbreaking programs and seminar series, click the appropriate links above. Say goodbye to lost revenue and hello to the success and lifestyle you deserve.